Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is an overview of medial branch blocks. Back pain affects 90% of Americans at some point in life. It's the second most common reason that people see a doctor, only behind the common cold. It's a leading cause of disability in those under the age of 45. Up to 40% of those who undergo back surgery are unsuccessful. And the cost of back and neck pain exceeds $100 billion in the U.S. every year. When you look at the facet joints in the back and the neck, they run all the way up and down on both sides. They're about the size of a thumbnail. Okay, left, right, left, right, left, right. They're the source of pain about 45% of the time for either back pain or neck pain. The intervertebral disc is the source about 40% of the time, and then the SI joints cause a lot of pain as well. The facet joints do have cartilage, just like other joints, such as the hip or the knee, so they are prone to arthritis. And although they're small, about the size of a thumbnail, they can cause big-time pain when arthritic. So trying to diagnose the source of pain in the facet can be a bit of a mystery. History and physical exam can help. X-rays can help. Here's a CAT scan that shows excellent-looking facet joints on both sides. But here, see how they look ratty and irregular and extra bone growth? That's arthritic. The interesting thing is that this person may have no pain whatsoever in their back, whereas this person may have ridiculous amounts of pain, so it doesn't always correlate. A medial branch block is a great procedure. Here's what you see. You have a nerve root coming out, nerve root coming out. So these little nerve endings here are the medial branches. All right, so let's take this joint. This is a facet joint in particular. Medial branches coming down, and medial branches coming up. So there's two sources of medial branches that supply sensation to a facet joint. So a medial branch, and they only have sensory function, no motor. Okay? So when you do a medial branch block, it's done for two reasons. One is diagnostic, to help tell whether that joint is really the source of the pain, and the other is therapeutic. It can provide pain relief for weeks to months. Okay? Modern pain doctors do use image guidance, which is also called fluoroscopy or ultrasound. The pain doctor will put the needle close to the joint, but not in it, because you're not going into the joint. You're just going around it to block these medial branch nerve endings. Numbing medicine is injected, possibly some steroid as well. It's an outpatient procedure. You really don't need IV sedation. It takes under 20 minutes. It's very quick. You don't have to just do one injection at one time. You can do a series on one side or bilateral. Now, as a diagnostic injection, it can help pain doctors figure out if that joint is the source of the pain. If the injection works well and then it wears off, you can either have the pain doctor can either repeat that injection or move on to what's called a radiofrequency ablation, which can give pain relief for a lot longer. It actually deadens these medial branch nerve endings, and that can provide pain relief for 6 to 18 months. Now, as a therapeutic procedure, studies show that the average pain relief from a medial branch block is over 3 months. The procedure works well in 85% of patients, and if the pain relief wears off, you can have a repeat procedure, and that can work just as well. Now, if the pain relief from the medial branch block wears off, either the procedure can be repeated or the patient can go on to have a radiofrequency ablation. This procedure heats up and deadens these medial branch nerve endings, providing pain relief anywhere from 6 to 24 months. It can be repeated because those medial branch nerve endings will typically grow back over time, and studies show that a repeat procedure works just as well. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at NewJerseyPainNetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.